Hi, welcome to the Mentally Healthy Workplaces Asia podcast. My name is Wen, and I'm the host of this podcast and the Chief Impact Officer at Flourish DX. So the purpose of this podcast is to be a platform for thought leadership, conversations, and practical guidance from subject matter experts, service providers, innovative tech platform, and employers in the Southeast Asian region. We as a community in Asia have a shared responsibility, not just as individuals, but also as employers, colleagues, and the broader community to help create mentally healthy workplaces so we can prevent suffering and promote human flourishing. I'm very excited today to have Cassandra Loh with us. Welcome, Cassandra.
Thank you for having me.
No problem. So you're a mental health advocate, and you've spent the last 10 years in the health sector, and you've just done something really healthy for yourself. You're on leave for 2 weeks. How's that been?
Well, it's only day 3, and I'm really, trying to spend as much time as I can, really just pampering myself a little bit. I haven't had a break in the last 10 years. So this is the first time I actually went for a run yesterday. I just sat at the park for like a 2 hours read. So it's things that I cannot imagine doing when I was, working the last 10 years. So it's been really nice.
Oh my goodness. I just want to say thank you so much for giving up this hour. I mean, like this lot to do this podcast in your time off.
No, my pleasure. I really enjoy talking to you. And I think this is a great, podcast that you're doing. So I'm excited to be here.
Oh, thank you. For Australia, I mean, I come from Australia, and at 10 years, you get a thing called long service leave in Australia.
Really?
It's 3 months. I think it's 3 months paid leave.
Okay, that's if you're in the same company, right?
Yeah, that's right.
Okay.
Yeah.
Okay.
But yeah, like 10 years is a long time. I mean, like people these days stay how many years in a job? 2? 3
well,
years?
I stayed in the first job for 8 years and then another 1.5 years here. So, but it's all in the shared space. So it's been a good 10 years. Just need, a little break, get back, on track, and then excited to go again.
Yeah. And so how did you get into the health sector? I mean, like what was your interest and what got you into mental health as well?
Yeah. So the interesting thing was they found me. I didn't find it, why I say that. I think my academic degrees were all in communication, nothing to do with healthcare. And I joined this private medical group. And at the time, it was when the economy was really bad and everybody was just scrambling for a job. And I managed to find a role in the healthcare group doing like operations, which is just doing anything and everything. But that's also where I got to learn so much about healthcare. And since then, I moved from primary care to tertiary care. And then I found myself being, some sort of, I knew a lot about operations in the healthcare space. That really helped me in my final role in the organization when I was doing investments into like healthcare startup, like tech startups. And that's where my eyes were open to all these new startups that I never knew existed. And that also led me in my next role in this current company where I was really working with these startups and forming out strategies, health and wellness strategies for corporate clients. And that's when I found mental health, because that was during the pandemic as well. And that's where mental health became a big topic. And that's where I really got even more interested in it. And then that's how, things came. So it actually came to me, and I'm glad it did, because I really am a believer of, mental wellness right now.
Yeah. Wow. That's a really great journey. And I think it's really in a holistic way as well.
Yeah.
That you've seen like, the physical kind of healthcare in all different kind of forms, and then now into the mental health.
Exactly.
Yeah. So, I mean, I guess in your role, your previous role as lead in health and wellness, and you work with corporate clients. And so how have you seen that, especially in like, I would say yet again, the last 2 years, gone from like a focus on physical health, potentially, and now really having a focus on mental health? How has those conversations happened, and what have you seen?
Well, I think in the past, before the pandemic, it's really difficult to even start a conversation about mental health, especially with companies in Singapore and actually in Asia. It is very common to be giving physical health benefits in the form of, it's still reactive, medical care in the primary care setting, in the tertiary care setting. It's the bare minimum, it's the standard. But once it comes to mental health, the question that comes back at you will be, what's the ROI? And And actually people do try to prove the ROI by, absenteeism, presenteeism, and all these terms that HRs will, hopefully be interested in and, would be willing to invest in. So it was a difficult conversation until the pandemic hit and people realized we really, really do need some support, but they don't know where to find support. And that's where we got so many requests in that role that I was in, the health and wellness lead, where people were asking us, what can I do for mental health? What kind of talks do you have? What do I do now? Do we have an EAP? What does our policy even entail? So it became, it was a reactive thing, but I'm glad in a way it happened, because then that's where we started educating corporates about what mental health really is, what mental wellness really was, and how we can help build that within the organization so that in future it doesn't have to be so knee-jerk. And that was really our goal.
Yeah. And okay, that would have kept you really busy, like insanely busy.
It is busy, but it is rewarding to see companies come around and say like, okay, I'm going to try and invest in this, and not look at it from an ROI standpoint, which honestly you will see it maybe in a longer term. It probably doesn't give you a short-term ROI and the finance kind of calculation manner, but you would see the ROI in the long term, but quit looking at it from that perspective at all, and see it as, something that will keep your employees healthy, and an active and healthy workforce is what you need and what you should be building. And that kind of shift is very rewarding when you see companies actually buy in and, actually try it out. Yeah.
Yeah. How cool is that? And like, I guess you were like on the front lines per se, really helping the companies who are trying to manage their employees. And I'm sure HR went through a really difficult time. I mean, so many of the people I spoke to, they're like, oh, someone in my team, someone in my organization, got a psychological injury or had burnout.
Yeah.
So I'm sure you heard a lot of those stories, which then probably sparked off, kind of, it is knee jerk in a way, but then, I guess it's good that it kicked off the process.
Exactly.
Yeah.
I mean, it's unfortunate that we needed a pandemic like this, with so much casualty, to bring up the importance of mental health. I mean, even before the pandemic, the company that I was in, they were already trying to push for the agenda of mental wellness, but it was so difficult. And now, just in a matter of like weeks, everybody was looking for it. Unfortunately, it took that, but I think moving forward, I am optimistic that, mental well-being will be built in to organizations' benefits, and, part of the basic bare minimum that is required for any organization.
Yeah. And did you see that in your conversations with clients, because your kind of remit was health and wellness, where they could see the link between the mental and the physical, like as in the physical manifestations on your full health, like when it started as a mental, did you have those kind of conversations around that?
We had, but it took quite a lot of convincing at the start, because it does seem like two very separate conversations, that topic, right? Physical health, mental health, but the challenge was to try and let them see that a good physical health could benefit your health mentally, and vice versa. Good mental health will be able to, promote good physical health as well. And I mean, there are many studies that you can cite, but at the end of the day, it is really getting employers and HRs and decision makers to really go back down to the drawing board to say, how can I restructure my benefits? How can I restructure what I can provide for my employees, and what the goal is from, restructuring this? That takes time. It still is a work in progress.
I think just with the segregation, how we think, like very modular, it's like, okay, now we're on mental health and that's one thing, but actually as human beings, we're like one person. And it's like, you have this thing where like how it's, I guess because in like allied health and like, just things like rehab, physiotherapy and all that, my husband's a physio. I mean, sometimes the patients that he sees is actually like, what they're going through is actually mental stress.
Exactly.
Which then manifests in like literally really, really tight shoulders, which then comes out in headaches, tension headaches, when it's actually all starting in terms of mental health and not because of just a physical route as such.
Yeah.
And I think people hopefully over time would see that, we're one being, and like when you have an approach, it needs to be holistic.
Yeah, I mean, and I think it also is awareness. I think there's not enough awareness about mental health for you to even identify that this could be a mental health related issue versus a physical issue. And the truth is, physical ailments are just more observable. It's easier to explain. I've got a tight shoulder here, and therefore you need physio, and then the physio will try and work on it, and then hey, it's not working out, and it takes a longer process. And that's why a lot of what I do is to really advocate for not mental health alone, but mental well-being, which starts right at the early stage, where we're just doing it for maintenance, so that we are more aware of ourselves. We are aware of what triggers, how do we feel today, and how is it different from tomorrow, and when is that not right, so that you actually are just aware of your body a lot more, just like the physical ones. How can you also be able to identify these kind of triggers on your own and be able to verbalize that to the person that's helping you? I think that's very important.
Yeah. It's a new skill I think a lot of people
It
have been
is.
learning, like a new
Yeah.
vocabulary, like
I
a
know.
vernacular, and just being aware. Man, this 2 years have been a big learning curve for a lot of things.
Yes, it has been. It has been, and it's a good thing. I think in Asia, mental health was just taking so long to really kickstart. There were companies here trying to push, but it wasn't really moving in the right direction for a long, long time. And I think these 2 years just expedited everything.
Yeah. So back to just your client conversations and in your role, what was let's say top 3 issues that your clients would raise in terms of workplace mental health? Or what are they really struggling with that they or like pick up the phone or text and say, Cassandra, I really need your help?
Yeah, I think one of the most obvious ones were managers didn't really know how to manage their employees, because their employees were now working from home and they were burning out. And I remember one of our clients actually asking for us to come up with a webinar that's addressing the managers, because people were quitting without jobs and they don't know why. And all the reasons cited out was burnout, but the amount of workload was exactly the same. And so they just couldn't figure out how we could help. And and they were scrambling for what the policy covers and what do we have. And by then, it was already very, very reactive and people were already leaving. And so they said we need to train up our managers. And so we do see that that's important. For managers, we don't learn this in business school. We don't learn this, and frankly, I don't think many people know how to manage employees working from home. It's new for every single person. So that was one big area, I would say. So that's for managers. Second was just resilience training was another one, where the pandemic is wearing everybody out. It wasn't just about work. I think all of us know, that the uncertainty, the stress that people were feeling, the children not being able to go to school, staying home, and everything just putting it together. The tension was just running high, and so we saw a lot of requests for like resilience, positive stress. How do you look at the situation in a more positive light? That was the second most conducted, I think, like webinar and request regarding mental health. But like I said, and we talked about it, I think physical health shouldn't be overlooked as well. So the third would really be how we tie in mental health with physical health. The pandemic was really unrelenting in terms of physical health as well. I think there was a study that said in Singapore alone, in 2020, people in Singapore gained an average of 5 kilograms in a year, and that's not good physically, obviously, but also not good mentally, because something's not right. Is it work-life balance? Is it not being able to exercise? Was it eating too much? Was it not being able to control your diet at home? Take ownership of your lifestyle, or what was it? And so that was the third part that we actually explored further with corporate clients, and I think that was also one that they were very interested in.
Yeah, very interesting. Well, on your second point, just like with everything happening, that's like we're holistic beings. Like, people have
Yeah,
children, people have,
exactly.
families are managing and all of that kind of crashing at one
Yeah.
point. That totally makes sense. But on your third one, in terms of weight gain, I actually just reminded me like on how many bottles of wine I'm pretty sure was
I know.
consumed or
Yeah.
sold, especially
Yeah.
during the first year.
Yeah.
Um, I know, like everyone, like kind of needed their creature comforts,
Yeah.
but I guess it gets to that really dangerous stage
Yeah.
where you're not managing your health well enough. You might not be eating. I'm sure takeouts and healthy food was on the rise. I remember eating like potato chips nearly every day,
Yeah, because
or
that was
like there was a period.
yeah, those were the very simple pleasures you could get because everything else is like taken away from you. And so people started to, I mean, takeout really went up. Bubble tea, until before they stopped bubble tea in Singapore. And when people stopped bubble tea, when they stopped bubble tea in Singapore, everybody, crashed. And like when McDonald's stopped serving in Singapore for a while, was it stopped being 24/7 or it stopped serving altogether?
Yep.
Everybody just went into like a frenzy. And I mean, this is also very telling of where we're getting our comfort from. It's okay to have guilty pleasures at sometimes, but
Yeah.
overall, do we know how to manage our stress? Do we know how to manage our physical
Yeah.
well-being and mental well-being? That was the deeper question.
Yeah. And it was because it was prolonged. It was a
Exactly.
much longer period.
And you
But
don't
then
see an end.
yeah.
You don't see an end. You don't know when the end is. That's the scary thing, right? That's the uncertain thing. You don't know when is this going to end, and that makes everyone uncertain and anxious about.
Yeah. Gosh,
Yeah,
just talking to you about this, like it kind of seemed like a lifetime away, like just
and it
recapping,
does. It
but kind
does.
of like it still hasn't ended. And so I'm sure these conversations with clients and just in workplace, like positive changes do have to be made because otherwise it's kind of like masking over it. Like, it's a
Yeah,
band-aid solution.
yeah.
And then it'll flare up again. It's like sweeping things under the rug. So unless you're going to deal with the root issues, then it's going to pop back. It's going to pop up its ugly head later on.
Yeah. So now when we talk to corporate clients, we always say it needs to be you need both strategies now. You need the band-aid for those who really need the
Yes.
band-aid at this point. But you also need a solution so that you don't have to see a knee jerk. You don't have to be so reactive only in future because everybody's going to go through stress at some point. Pandemic obviously is a global kind of thing, but all of us go through different ups and downs at different points of our lives, and we don't want to wait till that employee is going through the downest of down before they realize, hey, actually I could have sought help here and there. And so we want to be able to train our employees to just have again, like I said, awareness, resilience, and coping mechanisms, all these things that were not a thing in the last few years and only a thing recently. And that's what we're trying to, educate and kind of advocate for.
Yeah.
Yeah.
Oh, amazing. I mean, I'm glad that, there's some thought leadership around this area and just,
Yeah.
having like not just always a reactive, but to really set people up for success and flourishing for the future.
Yeah.
So then as part of kind of like your research and your advisory, you helped co-authored a Navigating Employees' Mental Health paper. So that was jointly done with Mercer Marsh Benefits and Workwell Leaders.
Mhm.
In doing that paper, what was the most surprising thing that popped up that you were like, oh, I didn't know this, or that took you by surprise?
One of I mean, there were certain studies that we did, and we realized, like, hey, we didn't notice that this trend was happening. But I think one of the most surprising thing was when we did this paper, the pandemic was already in for I think a year, maybe,
Mm.
and we thought we would either see utilization of mental health rise extremely fast because everybody was talking about mental health, and everybody were and we just expected the utilization to go really high. And to our surprise, it did not. Despite all the awareness, it was still a very slow pickup. That was first surprise. So then we thought, okay, slow pickup would just mean that nobody's spending money also. So utilization meaning the number of times people actually utilize mental health, right? That number was, or the number of people utilizing mental health benefits that they have, that was on a very slow rise. So we thought, that's strange. Then we look at the amount of money spent. With that slow rise, you would expect that the amount of money spent would be pretty much the same because that increase wasn't that drastic. But then we realized that the dollar amount spent was more than double year on year. And we were like, if it's the same number of people utilizing mental health, how come the dollar spent, it's, double and all that? And we realized that, hey, this is a very good point to share with corporate clients who are adamant to know what the ROI is, or why should I invest in mental health early. And that's because managing mental health is a chronic thing. And once you need therapy, for example, a therapy typically lasts 8-10 sessions. And again, if you need it, that's very important. But if you can build in some mental wellness strategy earlier on, you're hoping that less people would need that kind of therapy that would drive up your medical costs. So from my perspective, and I'm actually advising employers, and if you're looking at it from a cost perspective, as an employer, it also makes sense to make sure you have a healthier employee base. Because what's going to happen is, in the near future, most organizations will need to have some form of mental wellness benefit. And if you're just going to do the safety net amount, just, okay, therapy sessions if necessary, and if employees are starting to burn out because they haven't been trained with all these maintenance kind of skill set, and they're starting to burn out, they are going to spend all that benefit, and you are going to pay for all that benefit, which when it could have been brought way earlier, way lower cost for much more value, because you have a healthier workforce. So that was actually a very important point that we took back and started sharing with our corporate clients. And then they realized, oh, we're talking about it. I mean, if you want to talk about dollar and cents, we're talking about a lot of money in therapy. And what we're doing now is we're building awareness, right? Because that's what everybody, the government and everyone is doing. And the companies themselves are also building awareness. That just means utilization will go up. And with that very small utilization increase, you see a double in dollar spend. What will happen when your utilization goes double? What's going to be your spend? So does it not make sense for you to do something to bring this care more to a preventative rather than, a therapy? So, and leave the therapy for people who really need it. It's almost like a primary care versus hospital kind of, scenario, right? We're trying to let people be treated in the primary care setting rather than move into like tertiary care, where the cost is going to be higher, the outcomes will be less, not as ideal versus like, in the primary care. So that was one of the interesting findings from the paper.
Yeah. I guess like the parallel to physical health is that if you, let's say, people are injuring themselves physically from doing something like lifting a heavy box. Logically, you would train them and put, safeguards in place. Don't boxes can only be 5 kilos or less. Bend your knees, go for training, all these things. You would do all this in the physical sense to train someone, awareness and then training and then building good habits rather than just letting people go down the train of just
get hurt. Exactly. And then so when that happens, you either go for physiotherapy, which is like 6-8 sessions, and the outcome might not be, it will never be perfect, right? And in the physical sense, I mean, it could be it was a minor injury, the damage is done, or surgery. And, if you're talking about cost, it's, way more than just training. Wouldn't it be better to be like training them in advance? So that's a good analogy, and you're right.
Yeah, preventative and prevention is really the key. Because I think the onset, especially for mental health, it doesn't just affect yourself. It's your family, it's your loved ones and society. And I mean, I unfortunately had some friends who actually went through quite bad episodes in terms of workplace stuff as well. And just seeing them, I was just like, man, this is like taking really a toll on, they had young children. So can we all just like kind of everyone just advocate and kind of push people towards the preventative side, fix up the things in the workplaces that's causing the burnout and diagnosing it.
And we spend so much time at work. It is definitely, in my view, it's definitely the employers. They need to be involved. They need to be you need to build up the culture that is healthy, because we spend so much time at work, and with the pandemic and post-pandemic, work and life is going to be integrated even further. And so it is so important to have a very healthy culture within the workspace.
Yeah, I think even countries like, I mean, Australia, Canada, and the UK, it's really amazing to see that they're moving forward to actually move towards legislation and regulations that employers are required to provide a psychologically safe workplace. So like a health and
Yeah.
safety approach, and not just
Yep.
a physically safe workplace, because the
Yep.
injuries are just happening, and it's actually increasing faster than physical injury claims.
Yep.
So yeah, I think definitely what your work, has been doing, and just advocating for prevention, it's the key.
Yep.
So I guess in terms of with the mental health, kind of what are maybe 3 easy wins or practical tips for employers, and what has worked with your clients? You're like, lowest hanging fruit, because sometimes it feels like such a big task that it's like, oh, you know what, we don't have the space or brain power or time or budget to do XYZ. So maybe for our listeners, do you have any kind of 3 easy wins and that is effective that maybe they can adopt in their workplace?
Well, I think my first tip would always be listen to your employees. Listen to what they want, rather than rather than just providing a safety net. Oh, what are the other organizations doing? I'm just going to do the same. What the legislation is saying we need to do, I'm just going to provide the same. Oftentimes when you do that, not only would you end up spending a lot of money, wasted resources, your employees may not exactly benefit from it. So I think number one is to listen to your employees, find out what they need. And in my role, that's what we do for our clients as well, is to look at the demographics. There's no one size fit all. There's no one solution fit all. And put your resources in where it has the best yield. And like I said, out of 100% of your employees, it is quite common that 95% will actually fall into the maintenance phase, and only the 5% would actually, require clinical support. So how you divide your resources should make sense in that 95% kind of, so I think it requires a little bit more understanding of your organization. I think that's like the number one tip that I would have. Number two is to really focus on what maintenance really mean, beyond just clinical. So webinars are always a quick win, but I always tell corporate clients that webinar fatigue is a real thing. I mean, I have corporate clients coming and ask me, can you give me 6 webinars in a year? And I said, I can give you 6 webinars in a year, but how many employees are you going to give me that are going to turn up for the webinars? Because you can't just do things for the sake of doing things. You can't provide solutions just because it looks good or you think they need it. So I think webinars are great in terms of awareness, but you need an actual solution. So what is that actual solution for your company? How do you plan your full calendar versus just getting all the webinars and just putting them in? How do you build that whole full calendar of mental, physical wellness, and the holistic health? And actually letting your employees know this is the full calendar, so that they are, looking forward to it, and everybody has visibility as to, what you're doing, what the company is doing, and what kind of support you have. I think that is a better way to get more buy-in from your employees as well, and be seeing how you value add, whatever resources you're putting in actually value adds the company. So that's the second one. And the third one I always tell employers is to walk the talk. We can do as many webinars as you can. We can provide all these solutions if you just buy them. But if the company's culture is just not that accepting, if the company's culture just does not promote mental well-being, if the employer themselves, the CEO is expecting a response, in the middle of the night, for example, it is very difficult to be pushing mental health webinars and saying, hey, we care about mental health, but hey, remember to, come for the meeting at 10 p.m. later, So I think the culture and the leaders themselves actually walking the talk, showing that I know what my space is. I know when it's time to say, hey, I need a break. And doing that. So I have a lot of managers who say, I don't expect that from my employees. It's just me. I I have no commitments. Therefore, I'm emailing my employees in the middle of the night, and I am, working on weekends. But I'm not expecting that of my employees. It's just me. But that in itself builds that kind of culture. And as an employee, it is difficult for me to say, hey, I'm just going to tell my employer, my manager, I've got this space and I need, it's difficult. And so I always tell managers, you need to walk the talk, put the phone aside. Even if you have time, go and take go for a run, go and, take a break. I think that's really the third most important tip I would give.
Yeah. And maybe actually that was the number one tip, because without that, it would just be, I mean, I guess some people, if you're a skeptic, would say like, it's tokenism.
Yeah,
because
exactly.
you don't really mean it, and actually you may actually lose the trust of if you want to do surveys or any programs, they're like, oh, but this actually leads to nothing, it's just words. I mean, I think that's the hardest part, and it's also signaling, isn't it? Because if you don't do it, then it's like you're not kind of giving permission for your employees to tune off.
Correct.
To actually have a night off and to have a weekend.
Exactly.
Yeah. And I guess the hard thing is that eventually, and we hope not, but burnout's likely to happen. Like everyone has limits. Yeah. And I mean, everyone has different limits, but there's only a matter of time when it's kind of like they hopefully won't be bad, but they may feel it themselves. So I think self-care is so important now, more than ever. Because it's just been so long that we've been living like this.
I mean, we know that we'll go for a run, we'll do yoga, and that's because we want to be healthy, we want to prevent ourselves from getting any chronic diseases. These are practices that we're so used to. We eat healthy, we watch a diet and all that. But in the mental wellness space, people are still very afraid to say, like, I need time off for my mental well-being. I need to take some time for myself. And that is something that I always remind people around me to do. It's okay to say, I need a break. I'm not just for work, right? Hey, I'm not hanging out with you guys today. I know we do it every Saturday, but maybe not today for me because I'm just really tired. I don't have to have another reason or like make up some story. I'm just really tired. I need some time for myself, and that's okay.
Yeah, I think boundaries and saying no, it's also been really, really hard because everything's so accessible. Your phone, your laptop, your study,
social media, and the expectations. I mean, I don't want to get started with social media, but that in itself is expectations, right? You need to put on a certain kind of front or be able to feed that social media. I mean, I fall into that as well. Like, hey, we're in this restaurant, I need to take a photo because I need to show that I've been here. And we need to smile, take a nice photo, even if we're quarreling, if my husband and I are quarreling over the meal, but wait, let's take a photo first and let's post this. Okay. And then continue. We kind of live in this like semi-fake world, and that creates a lot of pressure for every single person.
Yeah. And that applies to work, social media like LinkedIn and all these things.
Exactly.
As well. It's not just the social, social things.
Yeah, I don't know if you realize, but recently on LinkedIn, I see so many very positive, posts. And I mean, those are great and they are encouraging, but sometimes it is also pressurizing to see how people are like, oh, I've got all my life settled. Oh, my work is this, my life is so great. Everything is so great and perfect. I just changed my new role. Now I'm, the CEO of this company. And all of these are just pressure. And sometimes I just say, maybe you should just step back for a while, let people be people, let them be what they are, and you be you.
Yeah, I think it's all highlight reels. That's a problem. Actually, I was on a break just for 2 weeks, went back to Australia, and I didn't post anything on Instagram because I was just like, actually, I just really need a break from it. It's really nice when people engage, comment, but then I felt like, oh, I have to reply back.
Exactly.
And I have to really be on my phone. So actually I barely touched my phone, and it was actually such an amazing feeling of just being with the people I'm with. Like literally it was just us having conversations. I took photos just for memories. Yeah. That was it. And they'd be okay with it. I was just like, I'm MIA. So I got back to Singapore. Then I'm like texting some friends. I'm like, sorry, I've been MIA. I'm back now. But being okay with that. So I think everyone's just kind of learning how to, I don't know, adult or work again in a very new environment. And hopefully we're all learning and getting better.
Yeah. I think we're all learning, and I think with more advocates, it's okay, to have your own space. With more advocates like these, if one friend tells you, hey, I need my own space, that probably empowers you to say the same thing in future to somebody else. And I hope that will just build up a better and safer culture for everyone to say, I need my space for my mental well-being.
Yeah, space, especially in Singapore, is not a very
yes, that's true.
I think it's trying to find a quiet space is it's not easy in Singapore.
Yes,
but
it takes some effort.
yeah.
Yeah.
Well, so I guess we always like to end off on two questions.
Mhm.
So what are your hopes for the future of workplace mental health? And then secondly, just in light of you're a busy person, you've got work, family, and all that. How do you manage the demands on your time and your personal mental health? So we'll start with the first. What are your hopes for the future?
Hopes for the future. I mean, I hope that one day in the near future, every organization would have, like I said earlier, a proper mental health, mental well-being structure. And that is really my personal goal, and what I strive to do, to really come up with something that suits every organization. I mean, granted, budget is something that we need to consider, the resources available, the employee base and all that, but everybody has something in place that is actually beneficial, so that everyone is able to find that kind of support in their job, whatever job that could be. So I think that was what I hope the future of mental health, to be in the workplace. Yeah.
Yeah, great. And yourself, how do you manage your own mental health and just, all the demands that there is on your time?
Well, so I have a 3-year-old girl, and she's a darling, and I really enjoy spending time with her. But from the time she was born, I had this conversation with my husband, and I said, we need to be able to draw the boundary. I mean, we do spend time as a family unit. I do spend time alone with her. I do spend time alone with my husband, but I also need time on my own. I need time with my friends. I need time for my work. And so I think being able to draw those boundaries and not feel bad about it was a lesson I had to learn. I mean, mom guilt is a real thing. But actually, I realized now that my daughter is 3 and she's a bit more understanding, her seeing me take time off for myself, hopefully would become an example for her in future to say, hey, I need to take some time off for myself. So even now, while people say I'm doing so many things, because while I'm still working, I'm looking after her. I'm also doing a graduate diploma in counseling psychology. And people are just like, where do you find all those time? And I'm still out with my friends. And where are you finding so much time? And I really think just my daughter seeing me going for classes and saying, hey, tonight, Mama is not going to be with you because tonight Mama's got class, but tomorrow I'll be here with you. It kind of is teaching her that, we all are able to say, I need my safe space, I need my time, and nobody has ownership of anybody's time 100%. So I think that's really what I do to protect myself and my mental well-being, drawing very clear boundaries, not feeling bad about not compromising on any. So when I spend time with my daughter, it's time with my daughter. I don't compromise on that. Spend time at work, it's work. So I try not to compromise on any aspect, but really draw clear boundaries. So I think that's what I do. And of course, exercise. I think that's the best way for me to relieve stress. And as much as I feel extremely tired, I'm like, I can't even bring myself to get out of bed today. Usually a run, even on those days, just a short 3 km run would actually just put me up and just feel much better after that.
Wow. I love how you're really managing everyone's expectations. I think it's communication and expectations. Yeah, I think that's the thing. It's like if you manage it and people know, this is what we discussed. I guess it's when you don't manage expectations, that's when it goes really sour. Because people get disappointed or angry that you're not there, but you're like, hey, we've chatted about
this. And I think one other thing I want to mention is that surround yourself with the people who are truly there to support you, because those people will not pull you down and say, hey, you're spending enough time with me, or like, hey, you're such a lousy mom, you're always out. I mean, people say that, right? Like, hey, how come you're out without your daughter? That you're such a lousy mom. So don't surround yourself with these people, but be those people who actually celebrate you and want the best for yourself, and then you will feel less pressurized to fit into the expectations of those other people that really honestly don't matter that much.
Yeah. Oh, great. Words of wisdom. And for any working mum who's listening, hope this is a bit of an encouragement. I mean, I don't have kids, but my sister has two girls living here in Singapore. And it's a tough, I mean, I see her working full-time job and balancing exercise, raising the kids and all that. So kudos and shout out to all the great mums and dads, working dads as well,
Yes.
who taking care, especially young children at this time where I hope they're still not like putting kids at home when there's a case. Is that still happening? I don't
Well, they don't anymore, but they make you do the COVID test before you can go. And my daughter hates that. So it becomes like, should we keep her at home, or do we force her to do the test so she gets to go? And I mean, that in itself is stress. Having your daughter unexpectedly home and you're supposed to work in itself is stress. And so that's why I think companies need to be able to promote a healthy culture, work culture, and also equip employees with the skill set to manage stresses like this that were unexpected, right? I mean, and that's really important.
Sorry, it just reminded me of my little niece. The two of them, the second one loves the test.
Right.
Like, it's so happy poking, and then she takes a picture and she holds the kit in different parts of her body. Like it will be her eyes one day, and then she'll pose with it, and she loves it. And the older one, oh my goodness, hates it, and it's a drama every single day when they have to do it.
My daughter hates it, like really hates it. I've come up with many stories, showed her videos, do it by myself. And her best friend, who's also her age, loves it. Like, it's a treat. Like, if you want to do a COVID test, go and shower, and then you get to do a COVID test. It's like a treat for her. And I'm just like, oh, it's so painful for my daughter to do it. And so I asked her, do you want to go on a holiday to Perth, actually?
Oh, yes.
I was like, do you want to go on a holiday? You want to take an airplane? And she was like, yes, I want to take an airplane. And I said, okay, but all of us will need to do the COVID test. All of us need to do it. Okay, we'll do it all together. And she was like, no, I'll wait for COVID to be over because I don't want to do the COVID test.
Wow, she hates it that much.
And I was just like,
that's a phrase, like I always think about this, and I mean, we've talked about this throughout the whole podcast. It's actually like managing people. Like, I mean, it's all about people management, and whether they're children or adults.
I'm still trying because I do want a holiday. I don't want to traumatize her with the test, but I hope one day she would. I'm getting there. I'm telling her how she could actually do it on her own, and I'm getting there. But
you need to find what motivates her. Maybe it's like a picture of a cuddly koala or something.
I don't know
something that she really loves.
I don't know yet what can get her to move that needle, but like I'm really hoping I find it soon.
Oh, I love it. Well, thank you so much for your time and just being on this podcast, and wishing you all the best in all the work that you do, and even studying counseling and all that. So for the listeners, thank you so much for dialing in today, and please subscribe to the Mentally Healthy Workplaces Asia podcast, so wherever you listen to podcasts, and you can follow us on our LinkedIn page as well, and for Flourish DX too, if you like to just keep up to date and see short clips of this. And of course, please follow Cassandra and I on LinkedIn if you want to stay in touch and keep the conversations going. So just thank you very much for your time, and we'll see you at the next one. Thank you.
Thank you.